Have you ever felt a little less stable than you used to? Maybe a simple bend to pick something up feels a bit harder, or you worry just a little more about tripping on uneven ground? Millions of people our age experience these subtle changes, often dismissing them as just part of getting older. But what if these small feelings are actually warning signs about something serious, something silently impacting the very foundation of your body? Today, we're going to talk about a condition often called the silent thief of bones, osteoporosis. It sounds complicated, but understanding it is simpler than you might think, and the steps you can take to protect yourself are often easy and accessible. Osteoporosis isn't just a medical term. It's a condition where your bones become weaker, like a sponge with larger and larger holes. It doesn't usually show dramatic symptoms until it's advanced. That quiet weakening can slowly, gradually take away your independence, make simple tasks painful, and perhaps most frighteningly, significantly increase your risk of serious fractures from even a minor fall. You might think this gradual change is inevitable, but the truth is, its impact doesn't have to be. In this video, I'm going to reveal 8 crucial things you need to know about osteoporosis as you age. We'll uncover how this thief operates, and more importantly, I'll share practical, actionable tips that can help you guard your bone health and maintain your strength and independence. Before we dive deep, if you're ready to learn how to protect your bones and stay strong, please go ahead and hit that like button right now. And if you haven't already, make sure to subscribe to the channel and ring the notification bell so you don't miss our future helpful health tips. Let me know in the comments below if you're watching along by typing bone health. All right, let's get started and understand what's really happening with your bones as we get older. First, let's truly understand what osteoporosis is and why it earns the nickname, the silent thief. Think of your bones not as solid rock, but as living tissue, constantly being broken down and rebuilt. When we're young, this process is balanced. But as we age, especially after menopause for women, or simply with time for men, the breakdown starts to happen faster than the rebuilding. Your bones lose density and structure, becoming porous like an old sponge. This happens gradually, often without pain or any obvious signs, silently, like a thief. It weakens your skeletal structure from within. I remember my friend Robert. He was always active, played a little golf. He never felt any pain or stiffness that seemed unusual. One afternoon, he simply tripped over a rug in his living room. It wasn't a bad fall, just a stumble, but he fractured his hip. It was a devastating event that required surgery and months of difficult recovery. The doctors later told him his bones were severely osteoporotic. He had no idea it was happening until that single, life-altering fall. Robert's story shows just how silently this condition can progress until a fracture reveals it. This is why it's so important to understand this silent aspect. You might feel fine, but the underlying structure could be weakening, making you vulnerable to serious injury that dramatically impacts your ability to move and live independently. The key takeaway here is, don't wait for a fall or fracture. Osteoporosis often gives no warning signs in its early stages. Now that we know how it works, who is most likely to be targeted by this silent thief? Next, let's look at the factors that can put you at a higher risk for developing osteoporosis. While it affects both men and women, particularly after menopause, are at a significantly higher risk due to the rapid decline in estrogen, a hormone vital for maintaining bone density. Other factors include genetics, if your parents had it, having a small frame, certain medical conditions, and lifestyle choices. I have another friend, Susan. Susan is healthy, exercises regularly, eats well, and has never smoked. She always thought osteoporosis was something that only happened to less active people. But when she had her routine checkup and mentioned her mother had broken a wrist in her 70s, her doctor suggested a bone density scan. Susan was surprised to learn she had osteopenia, the precursor to osteoporosis. Her family history was a major factor, proving it's not just about lifestyle. Understanding your personal risk factors isn't about causing worry. It's about being informed. Knowing you're at higher risk allows you to be proactive and discuss preventative steps with your doctor sooner. Talk to your doctor about your family history and any other risk factors you might have. This conversation is a crucial first step in prevention or early detection. One of the most challenging things about osteoporosis is its lack of obvious symptoms. Often, you won't feel your bones getting weaker. This is perhaps the most deceptive part of osteoporosis. Unlike a broken bone that causes immediate pain, the gradual thinning of bone tissue doesn't typically involve nerve pain. Bones can become quite fragile before you notice anything wrong. Sometimes the only symptoms are subtle changes that are easy to overlook or attribute to other things. Think about my neighbor, Mary. For a couple of years, Mary noticed she seemed to be getting shorter. Her clothes fit differently, and her granddaughter commented that Mary was shrinking. She thought it was just posture or age. It wasn't until she had persistent back pain that her doctor investigated and found she had compression fractures in her spine caused by osteoporosis. The loss of height was due to her vertebrae weakening and collapsing slightly over time. She never had sharp pain until the fractures occurred. This means you can be living your life, feeling relatively okay, while your bone strength is silently decreasing. Relying only on how you feel isn't enough to detect this problem early. Pay attention to subtle changes like unexplained height loss, changes in posture stooping forward, or unexplained back pain. These could be late-stage signs, but they are signs you shouldn't ignore. Has anything in this video surprised you so far? Let me know in the comments below. And because the bones are weaker, a simple fall can have devastating consequences. When your bones are weakened by osteoporosis, even a minor fall that a younger person might brush off can lead to a major fracture. Healthy bones are resilient. They can absorb impact, but osteoporotic bones are brittle. They snap or crumble more easily under stress. The most common fractures due to osteoporosis happen in the hip, spine, and wrist. A hip fracture in particular is incredibly serious for seniors. My longtime friend John had the unfortunate experience of this. John was just walking his dog. He wasn't rushing, just walking on the sidewalk. He slightly misjudged a curb and stumbled. It wasn't even enough to make him fall completely down, but he put his hand out to catch himself, and he instantly felt excruciating pain in his wrist. He had fractured it badly because his bone density was low due to undiagnosed osteoporosis. That simple misstep led to a painful fracture and a long period where he couldn't use his dominant hand. The fear of falling itself can become debilitating, leading people to limit their activities, which paradoxically can weaken muscles and bones further. A fracture means pain, loss of mobility, and potentially a significant loss of independence. Taking steps to prevent falls is just as important as addressing bone health. This includes checking your home for hazards, rugs, poor lighting, wearing sturdy shoes, and talking to your doctor about any balance issues or medications that might affect your stability. So, if you can't always feel it, how can you know if this silent thief is affecting your bones? The good news is there are simple and effective ways to unmask this silent thief. Getting a bone density test. The most common and accurate test is called a DXA scan or DEXA scan. It's a painless, non-invasive scan, kind of like an X-ray, but with much less radiation, that measures how dense your bones are, typically in your hip and spine. The results are compared to the bone density of a healthy young adult, a T-score, and someone your own age, a Z-score. My Aunt Betty was hesitant to get the scan. She thought it sounded complicated and wasn't sure she needed it. Her doctor recommended it because of her age, and the slight height loss Mary experienced had worried her. Betty finally got the scan, and while the results weren't perfectly normal, they showed she had osteopenia, not full osteoporosis. Knowing this allowed her and her doctor to create a plan focusing on diet, exercise, and supplements before she had any fractures. She was so relieved she got the information she needed early. Getting a DXA scan gives you concrete information about your bone health. It removes the guesswork and empowers you and your doctor to make informed decisions about prevention or treatment tailored specifically to you. Talk to your doctor about whether a bone density scan is right for you. Factors like your age, medical history, and risk factors will help determine if and when you should get one. Have you had a bone density scan? Share your experience in the comments below. If you do have osteoporosis or osteopenia, or even if you want to help prevent it, what can you do? Let's start with some fundamental building blocks. Two key players in building and maintaining strong bones are calcium and vitamin D. Calcium is the main mineral that makes up your bone structure. Think of it as the bricks. Vitamin D helps your body absorb calcium from your food. Think of vitamin D as the worker who makes sure the bricks get where they need to go. Without enough of both, your body struggles to build and maintain strong bones. My friend David was surprised how much of a difference small dietary changes could make. He wasn't a big milk drinker, and his vitamin D levels were low. His doctor suggested he start adding yogurt to his breakfast, eating more leafy greens like spinach, and taking a simple vitamin D supplement daily. After about a year, his follow-up bone density scan showed a slight improvement, and he generally felt better, knowing he was actively supporting his bone health through simple, everyday habits. Ensuring you get enough calcium and vitamin D provides your body with the essential raw materials it needs to keep your bones as strong as possible. This is a foundational step for everyone. Aim for calcium-rich foods like dairy products, leafy greens, fortified foods, some orange juices, cereals, and sardines. Get vitamin D from sunshine exposure safely, fatty fish, and fortified foods. Many seniors also benefit from supplements, but talk to your doctor about the right dosage for you. Beyond diet, movement is absolutely vital for bone strength. Certain types of exercise are incredibly important for bone health, but it's crucial to know which ones are beneficial and which to avoid if you have weakened bones. Weight-bearing exercise, activities where you work against gravity, stimulates bone cells to build new bone tissue. This includes walking, jogging, dancing, and using weights. Resistance exercises, like lifting weights or using resistance bands, also help strengthen both bones and the muscles around them, improving balance and reducing fall risk. However, high-impact activities or exercises involving bending and twisting the spine like sit-ups or touching your toes can be risky if your bones are already weak. Consider Linda. Linda was diagnosed with moderate osteoporosis, but was determined to stay active. Her doctor and a physical therapist helped her design a safe exercise program. She started with brisk walking, added some gentle weightlifting using light dumbbells, and practiced balance exercises like standing on one foot with support. She avoided the high-impact aerobics she used to do. Linda found that not only did her bone density stabilize, but her balance improved dramatically, making her feel much more confident and less afraid of falling. Exercise isn't just about muscle. It's a powerful way to tell your bones to stay strong. Choosing the right exercises can protect you while building strength and improving your balance, a double win. Focus on safe, weight-bearing activities like walking, hiking, or dancing. Add resistance training with light weights or bands. Incorporate balance exercises. Always talk to your doctor or a physical therapist before starting a new exercise program, especially if you have osteoporosis, to ensure it's safe and appropriate for your condition. What's your favorite way to stay active? Share your ideas in the comments. Sometimes diet and exercise aren't quite enough, and medical treatment may be necessary. For many people with osteoporosis, lifestyle changes are essential, but medical treatments prescribed by a doctor can also play a vital role in slowing bone loss or even rebuilding bone. There are different types of medications. Some work by slowing down the rate at which old bone is broken down, giving the rebuilding process a chance to catch up. Others actually stimulate bone formation. Your doctor will consider your specific situation, including your bone density scores and fracture history, to determine if medication is appropriate and which type is best. My acquaintance, Thomas, had severe osteoporosis and had already experienced a wrist fracture. His doctor recommended a specific medication along with lifestyle changes. Thomas was initially hesitant about taking medication, but he followed his doctor's advice. Over time, follow-up scans showed that the medication, combined with his calcium, vitamin D, and safe exercise, significantly increased his bone density and reduced his risk of further fractures. He felt reassured knowing he was doing everything possible to protect his bones. Medication, when needed, can be a powerful tool to help stop the silent thief in its tracks and reinforce your skeletal structure, further reducing your risk of debilitating fractures. If you are diagnosed with osteoporosis, have an open conversation with your doctor about all your treatment options, including medications. Discuss the benefits, risks, and how they fit with your lifestyle and other health conditions. Don't be afraid to ask questions. So we've covered the basics, the risks, diagnosis, and some key strategies. Let's bring it all together and talk about taking action. Let's make this even more practical. To boost calcium and vitamin D, try simple things. Add cheese to your meals, snack on almonds, or sprinkle fortified cereal on your yogurt. For safe exercise, consider joining a walking group, trying a gentle senior fitness class, or using resistance bands while watching TV. Even walking around your house several times a day adds up. A big mistake is thinking it's too late. It's not. Another is self-treating or relying on outdated information. Avoid high-impact exercises like jumping or running hard, and be cautious with movements that involve twisting your spine strongly. Don't ignore potential signs, however subtle they seem. And please, never stop or change a prescribed medication without talking to your doctor first. If you're lactose intolerant, you can get calcium from fortified plant-based milks, tofu, canned fish with bones like sardines, and calcium supplements. For vitamin D, especially in winter months or if you have limited sun exposure, a supplement is often necessary. There are many types of safe weight-bearing and resistance exercises. Find ones you enjoy, like walking, gardening, or using light hand weights. Remember, while this video provides valuable information, it is not a substitute for professional medical advice. If you have concerns about osteoporosis, especially if you have risk factors or have experienced a fall or fracture, please schedule an appointment with your doctor. They can provide a proper diagnosis and create a treatment plan tailored to your individual needs. So we've learned about osteoporosis, this silent thief, how it operates, and practical ways to defend against it. By focusing on key nutrients, safe movement, and getting tested, you are actively taking steps to strengthen your bones and, more importantly, safeguard your ability to live life on your own terms. None of the steps we discussed are overly complicated. They involve making informed choices about your diet, staying safely active, and having important conversations with your doctor. Small changes can make a big difference over time. I know it can be easy to put off thinking about things like bone density, especially if you don't feel sick. You might think, I'll deal with that later. But overlooking these early, silent signs can lead to significant challenges down the road to pain, reduced mobility, the fear of falls, and potentially losing some of the freedom and independence you cherish. It's not about being scared. It's about being aware and prepared. As we get older, our health requires a little more proactive care, but it's worth it for the quality of life it preserves. But here's the empowering truth. You do have control. Age is just a number, but how you live those years is a choice. You have the power to make choices today that build a stronger tomorrow, both literally and figuratively. You are not helpless against this silent thief. You can choose awareness, you can choose action, and you can choose to fight for your independence and well-being. It's never too late to start taking better care of your bones. As we wrap up, remember that addressing osteoporosis isn't just about numbers on a scan or specific exercises. It's about ensuring you have the strength and stability to keep doing the things you love of playing with grandchildren, pursuing hobbies, traveling, or simply enjoying a walk. It's about maintaining your independence and living your senior years with confidence and vitality, not limited by fragile bones. The silent thief can be challenged with knowledge and proactive steps. After watching this video, what was the most surprising thing you learned about osteoporosis? Please share your thoughts, questions, or your own experiences in the comments section below. Your insights can help others. If you found this information helpful and valuable, please give this video a thumbs up. Hitting that like button helps us reach more people. And if you haven't already, be sure to subscribe to our channel for more practical health advice tailored for seniors. Finally, and perhaps most importantly, if you know someone else, a friend, a family member, a neighbor who might benefit from understanding osteoporosis, someone who might also be unknowingly affected by this silent thief, please share this video with them. Sharing this information could make a significant difference in their life, potentially preventing a life-altering fracture. Thank you so much for watching and for investing in your health. I truly hope this information empowers you, wishing you strength, health, and happiness always. See you in the next video.